Good morning, everyone. It is 9 o'clock, and we'll go ahead and get started. People will continue to join, and that is just fine. Welcome, everyone. I'm Christy Gagne. I'm a program manager from Telehealth Rocks. And Telehealth Rocks is a federally funded program that focuses on school-based behavioral health. And we do this by working on social determinants, supporting school-based services, and telemetry trainings just like this one. We have a couple of other Telehealth Rocks team members with us today. Sage Brown, Chase Koob, and Haley Bell are here to help. They might put items in the chat or respond to questions or chime in during the session. Feel free to reach out to any of us if you need something. We're really glad you're here for this session to discuss social determinants of health, and we've got just a few notes for you as we get started. This session is being recorded and we'll send it to you afterwards. Your microphone has been muted, but feel free to use the chat or unmute to ask questions. And then to track attendance, please make sure your first and last name are visible on your Zoom screen or type it in the chat. We have no disclosures, and everything presented today is evidence-based and currently accepted within the profession. After the session, we'll share the slides and recording with you just as soon as we can. Give us a little bit of time to process those and get them out to you. We'll send them via email. We'll also post them on our website. Your certificates of attendance will be emailed after the series ends, so we will collect attendance throughout the series and then send you a certificate with all of your hours at the end. Please feel free to send any questions you have to our Telehealth Rocks email that we'll put here in the chat. All right, well, let's get started. I will hand it over to our speakers, Evelyn and Robert.
Christy, I really appreciate the warm welcome. Thanks everyone for joining us this morning. Next slide. We want to start off the series just hearing from you all. We really are interested in what one thing you're hoping to learn from the series. We're really trying to tailor things to fit what y'all are most interested in. So this just helps us kind of get a read for what you're hoping. So throughout the series, we can fine tune and really focus in on the areas that you that are your priorities to learn about.
So that's great to hear that you have a coalition because it takes a coalition to impact these things. And Chad, it does seem like sometimes we don't really understand the impact and issues that really affect our communities. One of the things we talk a lot is we are definitely a school-based program, but what we're about is community change and community development because it takes really refocusing our communities or helping our communities in order to really impact some of this stuff and both have kids that are ready and learning in school and successful. And it really means having a community that's successful. Yeah, Sarah, that's great to hear about your coalition. And Jack, it's great to hear about the economics because one of the things I've been talking a lot lately is some of this really comes down to poverty. And we'll be talking a little bit about poverty and income and socioeconomic factors, and both how they impact the social determinants of health, but also how they really kind of sometimes get in the way of kids being able to learn.
Well, and I know we're just getting rolling. So as we're talking throughout this session and then ongoing, we'd love to hear from you more about what you want to learn. I love the comment in the chat to you about just being excited to learn about the range of things related to social determinants of health. So thanks for everyone who commented. And again, we'd love to hear from folks throughout about what they're hoping to learn. We'll go ahead and go to the next slide, Christy. For today's session, it's really an overview session. So we're going to talk a little bit about the series that's coming up, just kind of what to expect with the whole series around social determinants of health and partnership. We're going to talk a little bit about how we got here and why Telehealth Rocks is especially interested with its network and partners and talking about social determinants of health um, as foundational behavioral health strategies. We'll provide a definition of social determinants of health um, and talk a little bit about measurement. We'll more set the stage of deeper dives that we'll hear in the next months about Healthy People 2030 and the 5 social determinants of health domains. And then at the end, we'll close just encouraging folks to think about goal settings and how we can get this information and really put it into action. Next slide. We're hoping really to hear what the biggest unmet needs are in your community that impact students and families. I know Christy's going to help with some of the instructions with the word cloud.
Yeah, so we'll put a link in the chat, or on the next screen, there will be a QR code, and you can skip entering your name on the screen that comes up once you either click on the link or scan the code. And then when you're typing in words, one word is great. If you want your words to show up together, then either put them with a hyphen in between the words or mush them all together like word cloud. It shows there. So we will hop to the next screen and we will see the instructions, and then we'll see the words populate. So I'll give us a few more seconds here to scan the QR code if we'd like. The link is also in the chat to click on.
I have to say, I'm not surprised to see transportation and housing being the big. We know we struggle with that in so many communities, whether they're urban, suburban, or rural. And housing is often such a thing that gets in the way and gets in the way of kids being able to learn and be in school and be successful. So these are really great, and so many great neighborhood needs, insurance, resources, health, mental health, insecurity. And then we're seeing some behavioral issues like autism and services for that, and education, belonging, racism, education, poverty. It is interesting, and we'll talk a little bit about how education is a social determinant of health, as well as educational outcomes are impacted by the social determinants. This may be the most different words I've ever seen in a word cloud. It's really interesting and exciting, and we will also send this out after today's session. Access to affordable food. That's becoming such an issue. Well, it seems like we're struggling with a lot of different things, some of them similar, and just a broad range of things that are really impacting our kids and our families and our communities. So thank you guys so much for this. And we will, of course, send this out afterwards and with all the resources. So we are,
I didn't hear that.
Pardon? I say a lot that we are a school-based program, but we really impact and focus on the idea that we have to support and change our communities so that kids can learn. So one of the things that you may ask is why social determinants when we're talking about kids, and we often focus on education, and why are we talking about, the social determinants of health, and how does that impact education? And so it's really important to kind of think about the fact that education and health, along with many other things, are interrelated and they fit into each other. Both education can create opportunities for better health, but poor health can put education at, excuse me, at risk. Health issues can impact attendance, which many schools are struggling with, concentration, learning, but it also, a lack of education and lack of educational success can lead to lower income and social and psychological issues and healthy behaviors. So, we want to really focus during this series on the positives and the ways that these things go hand in hand, and we can use them to make everything better for everyone. Um, so when we talk about the social determinants, we don't even really like this word determinants because it sounds like it is set in stone, which it's not at all. You can think about social influencers, right? So these are the things that kind of influence. If we don't deal with them, or if you don't have access to them, what outcomes are, whether it's educational or healthcare. Next slide, please. So who are we and why are we kind of doing this session? So Telehealth Rocks is not the end all be all, or we don't have anything answered. We are a collection of different partners that make up lots of different people, including school districts and healthcare and social service agencies and government. But we really believe that we can collectively create a world or create a society or create communities where schools and where we can create a situation where every child and family has what they need to have the same opportunity for success, that every child deserves the opportunity for success. So the work that we do focuses on areas like clinical services and training, like today, student prevention services. We work a lot with school-based community health workers, which we'll talk about a little bit today, and also always happy to talk about or make our materials available. And really that we have to engage and support both families, but we have to engage and support our communities. That we have to bring our communities and schools together because the needs of our children and families are the responsibility of everyone. Next slide, please. And often in an education setting, we talk about multi-tiered systems of support, MTSS, and school-based mental health and those types of issues. And so one of the things that we've done, and we're really fortunate to have federal funding with our work and to be partnered with school districts across Missouri and Kansas, is we really this idea that when we're intervening on things like food, clothing, and housing, that those are behavioral health interventions, but they're also education interventions because a child that has, a safe, nurturing, supportive environment, uh, have their needs met, is able to learn, is ready to learn. And a lot of this work comes out of my really idea in working with school districts, kind of where did we come from? This is the idea that we ask schools and we task them with the responsibility to educate our kids and the success of our kids and their readiness to learn and have careers. But we have to provide the resources because we can't tell a school the child that is hungry, that doesn't have the food, that doesn't have a bed, um, that it's their responsibility somehow to help them learn anyway and help them be successful anyway. So we have to add the resources to the community. And we can do that with foundational work like family, school, and community partnerships, which is a lot of what we do. Uh, Tier one, which is really creating these safe environments and promoting all students' health and success. Tier two, where we work about early intervention and really especially focusing on those students that have risks. So one of the things that we do is we work on immigrant children. We work a lot with children that are at risk of child welfare and have specific approaches and interventions and partnerships related to that. We work a lot with children that are at risk of juvenile justice and are involved with the justice system and have partnerships and programs related to that. And then tier three, which is these intensive supports, and these are these kind of one-on-one services, whether it's mental health services or direct clinical healthcare services or working with the CHW on an immediate need. We really believe that it's important in that multi-tiered systems of support to also be taking into account the social determinants of health in this work because it impacts all of those things. Next slide, please. I'm going to hand off to Evelyn because she is our clinical psychologist, and uh, this is a really interesting approach and important approach to mental health.
Thanks, Robert. So, as our child psychologist, I'm super interested in how does meeting social determinants of health needs help improve child and family behavioral health outcomes. So we're really looking at this model of social determinants of mental health. And so, with social determinants of mental health, it's all the same determinants of social determinants of health, plus the additional determinant of stigma, and trying to keep in mind how mental health concerns can also have that additional social determinant. With this model, it's looking at what pathways cause uh, poorer outcomes. So, if there are unmet social determinants of health needs, we saw, of course, the really big ones in the word cloud around transportation, housing, as well as many others were addressed in the word cloud. And so, the pathways that we think may influence those leading to poorer outcome are reduced options or choices for students and families, greater behavioral risk factors. So, being more at risk for substance use disorder, being more at risk for challenges with healthy lifestyle and healthy eating, all those sorts of behavioral risk factors, putting greater physiological stress on the student and family. So really having a whole body response with the continuous stressors that then lead to poor mental health outcomes. And then finally, the psychological stress associated with traumas and other things that go along with unmet social determinants of health needs. So I think this model is most helpful to look at the flip side, um, and looking at as we address these social determinants of health, it really helps the patients who are in my office. So it helps those students. It helps really every student with better wellness and mental health outcomes. Next slide, please. This is our reminder slide that with the Telehealth Rocks approach, um, we're really fortunate to be able to add school-based community health workers to the student team. So the idea is that it's really someone um, on the team that has full focus and dedication to meeting social determinants of health needs. Um, I know with some of our other Echo series, and then just at work in general, there's just really amazing stories, and then um, just really innovative ways that the school-based community health workers are helping students and families every day in meeting needs. For the purpose of this series, we're really trying to think about whether it's the school-based community health worker or other workforce roles, how can that person or people really then help meet these needs? We recently had a publication that looked at the real challenges if those workforce needs are put on the clinician or are with other folks, just really having enough time to be able to meet those needs. So again, we're really excited about the community health worker role to really have that focus on being able to meet the needs that students and families have. Next slide, please. And I
So,
think I hand this off to you, Rob.
yeah, the social determinants of health. So I know we use the word determinants, which makes it sound like it's set in stone. It's not. And we talk about health as if that's the only thing that's impacted by these things. So I like this definition. It actually comes from the Cleveland Clinic. I started looking around because I didn't like what the CDC and Health and Human Services and other kind of official terms for social determinants were. And I like this a lot better because it makes it pretty simple to understand because we know this. We know that personal, social, and environmental things not only impact your health, but they also impact your well-being, your quality of life, and your educational success. So I like that it's broader because these things impact lots more than just your health status. So some examples of things that impact, your well-being, your quality of life, your health, and your education are your income, your education level, your jobs and its benefits. Like, do you have health insurance and paid time off? Are there resources in your neighborhood? You have access to things like food, which came up, public transportation, which came up, childcare, which comes up more and more, your sense of safety and security in your neighborhood, the availability. Do you have access to healthcare? Quality of the air you breathe, the water you drink. These are environmental factors, right, that make us be healthy, and they're actually low-cost ways to get everybody a lot healthier. When we we started, having clean water and clean air, it impacted everyone's health. And then your relationships and social connections, and we can't lose that people need social interactions and connections and to feel supported. Next slide, please.
So
Evelyn,
this
I
is
think that's you. Yeah.
Yeah, for sure. So this is just saying what Robert just explained in a little bit different way, really looking at the social determinants as the cause of causes. So really those foundational things that are eh, uh, really influencing everything else that we see with students and families. So the idea is really understanding the root causes or the social determinants. It helps with an understanding of the conditions. This is another common social determinants of health definition. So, looking at where people are born, grow, live, learn, work, socialize, age, all those many important activities of life. Um, and this is really saying that the fundamental drivers of health and mental health status and long term success are those in the soil, social determinants of health causes. Um, I think that the exciting part of looking at this is also seeing that, you know, in meeting those social determinants of health needs, then on the tree, we can really see a lot of positives with by meeting those needs, we see resilient children and families. So really, the green leaves on the trees, and so um, you'll hear that a lot through this series. Is really thinking about by meeting those cause of causes, how it really helps families, communities, and schools thrive. Next slide, please. Um, this is just a slide that really helps kind of put some of the social determinants of health um, needs that we see in our states um, in comparison to national rates. And I think what we see in general is that we struggle with some of the same as that we see across the nation. Um, I also understand this is a very kind of more big picture as you do deeper dives into your own communities and even specific school areas. It really can give greater definition to some of these areas that we see at the state level. So just looking at areas, parents lacking secure employment. Again, in our region, 1 in 5 to 1 in 4 really struggling with a lack of secure employment. Um, Children in families that receive public assistance. Food insecurity, uninsured children. Um, we saw the households without a vehicle or transportation challenges. And then all those sorts of things I think influence this last one. We're doing a lot more looking at children who are chronically absent. And I think, we see really uh, even post pandemic, we're continuing to see really high rates of children missing the learning environment and missing out on some of those really crucial learning experiences. But I think you see the one above with households without a vehicle or food insecurity. I think we see how the social determinants interact with one another with those kinds of gaps. Then it can really set up that final one with chronic absenteeism. So it's just more just to help us think about our community struggling with some of the same social determinants needs as we see nationally. Next slide, please. We're going to go through each of the social determinants of health language a little bit, just for a little bit deeper dive into each of those components with the series. So on the social side, with this series, we're especially looking at the social components. You'll see that with this impacting social determinants of health partnership, we're really leaning into how people came together and communities came together on the really social and partnership side to innovate and come together to try something new to meet social determinants of health needs. Um, and then we had a series that was part of Telehealth Rocks in spring of 2024. So we're excited to bring some of that information back about how some of those innovations have progressed. And you'll hear that kind of throughout this whole series. Next slide, please. Oh, I think I
So
hand off to you, Robert.
yeah, so this work, and one of the things that we really do and work hard at is this idea of partnership and bringing schools and communities and others together. Because, often people think about having a CHW in the school and they are amazing. But if they don't have linkages and they're not known in the community and they're not partnering in the community, then they're really not able to accomplish much to meet those kids' needs. And it's so interesting. I've been at this now for a very long time, working in healthcare, but working with schools on student needs. And it's often so interesting because the community wants to support the school, but they often find it hard to interact with the school or to get in contact or know how to partner with the school. Yet we hear from schools the same thing, that they need more resources, that their kids need things that are, and they don't know how to get them from the community or how to partner or kind of correlate things with the community. So it's important that these things go hand in hand. We all have to work together. I believe that children are all of our responsibilities, our collective responsibility, because their success and achievement is our society's success and achievement. And it's just really important because we all have to get involved because this problem and the issues that our families and our children and our communities face are so much bigger that we can't do it on our own. We have to do it together. We have to partner because we can only, you don't partner if you can do it on your own. If a school could just help a child's get every need met and have educational success and go on to great successful lives, then they wouldn't need their community. But we know that we can't do that, that it takes everyone. And so it's important that we partner and that we all work together because, it's the good of our own society and it's our own future and it's our own success, even economically, that is, crucial to this, that, this doesn't happen unless we can work on these things together. Next slide, please. So here's an example of who we work with, right? So we have schools, behavioral health providers, federal agencies. We're really fortunate to be funded by the U.S. Department of Health and Human Services, both the SAMHSA, Substance Abuse and Mental Health Services Administration, the Health Resources and Services Administration, even the National Institutes of Health. And we have really strong partnerships across the state of Kansas and Missouri. Here in Kansas, we work closely with Kansas Department of Aging and Disability Services, with the Kansas Department of Education, Kansas Department of Health and Environment, Kansas Department of Corrections, and Department for Children and Families, because we know that all of our kids need our help and that all of us have to work together to meet the needs. And then it really involves listening to local schools and listening to local communities, understanding what their needs are and looking around and working together to try to meet those needs. Next slide, please. So when we talk about partnership and how to make it successful, and what we're going to hear about in these sessions are lots of people that have partnered together. So every single session is going to look at a social determinant of health, and we're going to have a community school partnership, beginning with the next one, where Community Health Center of Southeast Kansas, Krista Postai, the CEO there, and Craig Carell, the superintendent in Coffeyville School District, are going to talk about why did they back in 2011 put a school clinic in Coffeyville schools. What were the reasons? How was this an education issue? Why did this need to be in the school? But also, why did this make sense for a community organization to serve that population? How did they serve that population of Coffeyville, for example, better by having a clinic in the school as well as in the community? So when we talk about partnership, we have to talk about there's some basic things that are incredibly important. We have to trust, we have to treat each other respectfully, we have to understand each other as equals, though we're all in this together, as I like to say. We have to prepare and understand what each needs from the partnership We have to collaborate, always have to communicate and make sure we're clear with each other and we understand each other. And we have to have a common goal. And the goal has to be something we can't achieve on our own. And next slide, please. So, like I said, we're really excited. Today, we're talking a little bit about the social determinants, kind of a warm up and trying to get everybody on the same page. It's been so great. We have so many people from different backgrounds. So, just had a great conversation, and some people put some great information in trying to think about what does chronic absenteeism mean? Because for some people, that's not a term they know. I know for many of you, you probably don't really know what a social determinant is or haven't heard of this word before. And it's lots of big words with lots of big syllables. Because we don't often, in an education environment, for example, we don't talk about social determinants. We talk about Maslow's hierarchy of needs or social, emotional, or lots of other things. So part of it is just really making sure and beginning from a place of talking about what these things are and why they impact kids in our communities. So next we'll talk about healthcare access and quality with Krista Postai and Craig Carell. We will talk about education quality and access because that is a social determinant. And we'll talk about some interesting bring some people together that have brought schools and communities together to work on some of these issues. Neighborhood and built community, especially this really great program in the Kansas City, Kansas schools where kids that are McKinney-Vento, they are housing or housing unstable, are being referred to a community organization and they're working with those families on getting housing, the social and community context, and then economic stability. Next slide, please. Evelyn, it's yours.
Yeah, so this builds on what Robert was describing, that this series will really lean into hearing the stories about how different partners came together to innovate in meeting social determinants of health needs. And I'm really grateful for the presenters we have coming up. They really took leaps to try new things, and we're really lucky to hear from them. Of course, what worked really well, but also from each and every presenter, they share things that didn't work just like they expected first off the bat, and sharing with us what they learned and how they continued to partner through those challenges that are, will inevitably come up. So this is just a slide that really emphasizes the continuous improvement mindset that we'll hear from all the partners that are presenting about their social determinants of health approaches. I really like this graphic because it's pointing to all that work leads to hope. And I think that's what we're really aiming at with this work that we're doing together. By innovating, we really get at what's key to hope. I'll be a little bit nerdy psychologist and talk about hope, or how I learned it is really looking at, do we have goals? And goals are one key component to hope. So we'll hear about the goals around improving social determinants of health. And then the second component of hope is, do we have pathways to get there? And not just one pathway, but multiple pathways. And we really will hear that from all the speakers about the goals and pathways coming together, um, seeing positive change in their communities, and then using it as a springboard then to even try something new, to meet the needs that remain. Next slide, please. So we talked about the social, the S factor. We're talking a little bit about the determinants, or the D of social determinants of health. Um, we'll ask you to type in the chat what language you use, what words you use to talk about the determinants and social determinants of health. Um, Sometimes determinants isn't everyone's favorite word because it can come across as something that's unchangeable. And that's not really what it means in this context. Um, Determinants are just talking about the factors. But again, not everybody loves the determinants word. There are other options that have been utilized to talk about social determinants. Some folks talk about social drivers. I see in the chat challenges and needs. That's really super helpful. I like how you're describing that. Some people have used the language of social indicators of health and education. Um, I really like that one. It's a mouthful, but I like the idea. It's really talking about how we have we see the same factors when we talk about the social determinants of health and when we talk about the social determinants of education. Um, and then I know folks are typing things in. Um, there may be other language that you all are seeing and talking about determinants. We just wanted to say out loud, we're using the word determinants when we're describing that in our series. Um, just partly, we see social determinants. It's also aligning, and that language aligns with things such as billing and other things. But we just wanted to kind of acknowledge there are other terms for this series. We're choosing to use the word determinants. Oh, life needs. Thank you, Sarah. That's another really good descriptor. Next slide, please. Social factors. Yes, thanks, Haley. That's another really good way to describe determinants. Thank you.
So I'm a public health guy, and sometimes I think we talk about health, and you guys, and we all think about it as clinical care, right? That's going to the doctor. But in a public health perspective, and just in terms of our overall healthiness, whether it's physical health or mental health, about 50% of that is related to our community that we live in. And the remaining 50%, things like healthcare, right? The 20% that's your healthcare, if you don't have access to a doctor because of uninsurance or there's not one in your community, then that's going to be impacted by the social factors and environment as well. So we know, especially, and I have quit talking about COVID in terms of recovery or as an event because I think we have to accept almost 5 years into this that, some things have changed about our society and about our kids and just about how we respond to our environment and our environmental needs. Um, that we're not, they're not going back. We want to impact them. We want to, but we can't continue to be hopeful. I want to be hopeful about lots of things, but I'm not, I want to get past the idea that COVID impacted this and somehow it's going to get better. We are seeing kids catch up and learning, but what we're not seeing is the kids that were already behind. So a lot of this work during COVID and the federal funding that we received came about because of our realization that the kids that had the school, they were out of school, they dealt with a traumatic event, and they came back to school. And we started seeing in the fall of 2021 as school started to go back in session. Um, for kids that had their needs met, their daily needs, and I started talking about the daily trauma of life, right? If you don't have enough food, clothing, housing, you have insecurity in your life, that's a traumatic event on a daily basis. We realized that those kids were going to stay behind because they already kind of had things in the way of their success, and that COVID for some of these kids would not be something they would recover from as easily. And so we wanted to start to begin to develop resources to help them recover, and also help sort of create a situation where every kid had what they needed so they could be successful in school. So that's where this idea of health comes from. It's about well-being, and that's why I like that word better, because we can all think about well-being and we can all think about that every child deserves what they need to be, just be well, to have a good life, to be happy, to be successful. So next slide, please. Evelyn?
Yeah, thanks, Robert. I appreciate we see in the chat that Pamela mentioned just that when there are a lot of challenges um, and social determinants of health challenges and poverty, how that really can get in the way of even just having the bandwidth and time to dream or set goals, and how important that is. So I really appreciate that. Such a really good point, and how if we can remove some of those barriers, it really helps, not just with our hope for us addressing children's of health, but of course the hope of the children and families we're working with. And really, it's that's really both a feel good comment, like we all really want that for children and families, but as a practical comment too, that um, that really it can help set children and families up for success. now in the future. So I really appreciate that comment.
And I just wanted to say, I put in the chat that there is a validated measure you can use to look at what we call hope. And one of the things that is asked there is this idea of when I have a problem, I can think of many ways to resolve it. Well, when we talk about families and planning, or even the idea that they can overcome their problems, if they can't conceive of ways to overcome their problems, then it makes it very hard to be able to think about things like, um, how do I resolve my situation? And so a lack of hope is really often an issue that leads to, social determinants of health, but also just lack of success. And so we have to think about, how do we help people see that they have an option? How do we help people begin to understand how to look at multiple ways to resolve their problems? But also, how do we help people resolve their problems so they can see that their problems can be resolved? Sorry, that's just my addition. Thanks, Evelyn.
Oh yeah, for sure. I think it really it's perfect timing when we're this slide is really saying behavioral health is health, and just reminders. That's a bit singing to the choir, I know, but when we're talking about hope, it just so much aligns with behavioral health and well-being and wellness. So it's really perfect timing to talk about some of that. Um, this is talking about some of the big challenge we have in behavioral health, and the idea that by addressing social determinants of health, it helps with um, health, medical health, behavioral health, dental health, all the sorts of things. Um, and that you'll hear that throughout. We'll talk about all of the health areas. Again, with behavioral health, really challenges around depression, anxiety, loneliness, unhealthy lifestyle, as well as really concerning risks for suicide. Um, you'll hear through the series some about some of the emerging challenges that students face around social media and technologies. Um, we just saw the Surgeon General also in the last month issued um, a report around parental mental health and how important that is. So it's just acknowledging that through the course of talking about social determinants of health, we'll really be trying to think about how meeting those needs helps with this holistic idea of health. Next slide, please.
So we talked a little
Okay.
bit about the social determinants. Here in the US, there tend to be five. The CDC, US Department of Health and Human Services, others. From Canada, for example, there are 12. So I already kind of went through what the next sessions are going to be about. And so this is a little bit of a repeat, but it's really nice. And this is again from the Cleveland Clinic, because they do such a nice job of explaining it kind of clearly and simply. So economic stability, what are those things that relate to how, this is like how much money you earn, how can your income meet your family's needs? Education access and quality. So this is the education you receive, how well it supports your learning needs, healthcare access and quality, the healthcare you receive, how it meets your mental and physical needs, your neighborhood and built environment. Those are things about your zip code and the community you live in. And do you have what you need in your community to be healthy and safe? And then the social and community context, which we can't avoid or quit thinking about, because it's so important that people have those social connections. Those are your relationships with your family, your friends, your coworkers, and community. Next slide, please. And this is Evelyn.
Yeah, so we're just gonna go through these super quickly. It's more a preview of what you'll hear throughout the upcoming sessions. We will talk about each of the five domains that Robert just talked about in relation to Healthy People 2030. They have really a lot of fantastic information about social determinants of health. Really, in talking about what's the goals with each social determinant of health. Um, and then you'll see that the bucket is pretty big in each of the different five domains of social determinants of health. And we'll do a deeper dive into, what's the scope of each one of the social determinants of health. So we'll see healthcare access and quality, education quality and access. Next slide, please. Neighborhood and built environment, social and community context, and then finally economic stability. So we really we're excited with economic stability, and then really this whole series. Um, it will culminate with Dr. Matthew Desmond's presentation. So really, he's a national academic expert on poverty and impacts of poverty, as well as work with housing and other areas. He's really approaching it as a sociologist and really kind of bringing some of that kind of thinking. Um, I know we'll more to come on that. We're really using that as the springboard board. There's going to be things we agree or don't agree with that, but we're really looking at that as a springboard for a lot of discussion and helping us think about innovations in our own communities. Next slide, please. We've talked about some of this already. It really is just this idea that each of the social determinants of health depends on the other. Um, and each thing interacts. The great discussion in the chat about some of the chronic poor attendance is really a great example of what we're trying to convey with this slide. The idea is that if you help with one thing in that really web and interdependence of social determinants of health, it really can help with lots of things. So, for example, getting at what is causing the chronic poor attendance for the particular student and really learning for that student and family what social determinant may be impacting being able to come to school. Um, that may be the really big things that we saw, the housing and transportation. It may be a set of health and challenges around health conditions. Whatever that particular need is, if you're able to help meet that need, then it can improve each of the different areas. It can for sure improve education and being there ready to learn. Um, and then it can really ripple out and affect many of the other areas. So again, I think that this is pretty intuitive. It's just that idea that um, as you improve one area, it really can help and help other areas rise. Next slide, please.
So we'll go through these quickly, but there are, I talked about the hope scale, which is not a social determinant measure, but one that we're really interested in as we begin and continue our work for how do we help families feel like they can get their needs met, and how do we help kids really believe that they can achieve their goals, including educational success. So there's a number of different ones. So we just wanted to kind of bring up that if you're interested in kind of how do we assess these things or how do we determine what needs are, Prepare is one that's used by federally qualified health centers. WellRx is one here in Kansas that's being used by mental health centers and the certified community behavioral health centers. We in our work use the Arizona Self-Sufficiency Matrix, but there's lots of others. And I don't know if there are assessment tools that any of you use, but please put them in the chat if they are, and we'll talk a little bit about those. But the next slide, we can talk about the one that we use, and you can look at the measures or the things that we look at. Um, so we use the Arizona Self-Sufficiency Matrix. We really like it because across each of the questions related to things like shelter and housing and employment and income, it you kind of look at and people get to define what their situation is. One would be, related to kind of, I have no housing, um, when it comes to housing, and five would be I have housing that's stable and things like that. So certainly we can, and we'll put a link in the resources, and you can see kind of what the questions are, what the conditions are that meet each of these. But what this helps, and what's really nice about it, is it not only helps you understand what a family's needs are and where we need to intervene or help them figure out what the resources are. But we can also learn about our community this way, because if we're seeing that everybody is saying they don't have stable housing, they don't have stable transportation, they don't have stable employment, then those are the kinds of things that we want to work on as a community. Next slide, please. And then this is just sort of another approach as we think about kind of why are we saying that we got to get to the basic stuff? Why do we have to get to food, clothing, housing? Um, it's because what these things impact, as a root cause matter all the way downstream, and so if we can't get these basics right, then a child's not going to be able to learn. A parent's not going to be able to feel that they have their needs met and meet their child's needs. And it's going to lead to this issue of hope. Next slide, please. So, Elaine, I'll pass on to you.
Oh yeah, thanks, Robert. Just it's our encouragement. We appreciate all the input that you all provided today. We really want to keep in touch, both to share your ideas and resources around social determinants of health. Um, I know Christy, in just a minute, will share the contact and just ways that you can share that information, so we can then share it back with everyone on this call and everyone participating in the series. We really we're encouraging folks to think about um, what you or your organization, what the overall goal for attending the series is, and all the monthly activities. Um, the HHS recently released a call to action around addressing social determinants of needs across the nation. So they talk about some of the ways that they suggest and ask people to think about as they're setting intentions around social determinants of health. So as you think about your own work, it's some things that may or may not fit, but they talk about thinking about, is it focusing in on convening or bringing together community members? We're hopeful that with this series, that's one thing that we're aiming to accomplish. With your own intentions, is it integrating or looking at some of your community's data and information about social determinants of health? Is it influencing or thinking about how this work can lead to developing policies and solutions? Is it looking at a change and ways to contribute to small and big changes? Um, and so we'll try to prompt back with this question every time we meet, just having folks think about um, what's their progress toward that goal that they want to accomplish by attending this series. Next slide, please. Um, Again, I, I think we have a few minutes. Is that right, Christy? So if folks have anything they want to share, we'd love to have you unmute or type in the chat. Again, we've touched upon a lot of things today, so I know it's a lot to take in.
And it's so interesting. We just started a conversation or been hearing a lot about food and that kids can't learn without food and just some really interesting stuff about district providing free breakfast and lunch. And, even when we talk about summer programs and summer food programs, I know it sometimes seems weird that, why is the school providing meals over the summer? But we know that our kids, these things impact their ability to learn and their impact to be successful. James Harmon, it looks like you have a question.
Well, you're talking about, I work with Department for Children and Families here in Kansas. I'm the program manager for customer affairs, EES, in our metropolitan region. But you talk about changing the conversation, and my staff go out and meet with agencies. So I'll make it short. What we've done is, because a lot of people look at, okay, I get $160 a month food stamps, that doesn't feed my family for the full month. We understand that, but what we're trying to communicate is every dollar we can save you is a dollar you can use somewhere else, as well as food stamps don't go away in a month. You can use them. It's the cumulative effect of what can happen when you have that. It's like, 150 a month in 2 months, it's $300. What can you do with 300? So when we move it away from the specific for how much they get each month, yeah, it's not going to pay for your food. But look at what you can do in a month or two or three. If you had $300, imagine how much you could save up from Aldi's, or that's the month you buy your proteins, you go get the meat, that you need for your family. So it's opening up that idea because, the families that we deal with day to day, they're survivors. They function on what they need to address today. And so sometimes they don't see the big picture. And when we start communicating it like that, it really helps them understand, oh yeah, and childcare especially, every dollar we save is a dollar they can use to help bring themselves up. So
It takes everything and it takes everyone and it takes hope. I totally agree that, and I think sometimes we lose heart, um, because we know how, some of this we've had, even in the Bible, it talks about the poor you will have with you always. But we can make it better. We can change our communities. It takes finding those things that we can agree on. It takes bringing people together. Um, it takes partnership. And we're seeing some major changes in the communities we work in. And part of that is just how much everyone is working together on the same things. So I believe in I don't believe vision statements are pie in the sky. I really do believe we are going to create schools and communities everywhere we work that lead to successful kids, that to lead to every kid being successful. I believe it. I know we will. We already are. So, I think the one thing I want to get from this is not the idea that, oh my gosh, there's so much to deal with, but I want us to get that we can change this. We can make it better, and our kids can have their resources and their needs met, and our families and communities can be families and communities that have their needs met, that support. We work in Southeast Kansas and we work in lots of places, but we started in Southeast Kansas, the poorest, least resourced area of the state. But I would argue that nobody has stronger organizations and stronger people than you see in Southeast Kansas and more innovative approaches. But it takes us really believing we can change things. I think we need to go on to the next slide because I talked too long and we don't want to run out of time.
This one is just summarizing what we talked about together today. Next slide.
So this is what we'll do every month. Not today. This was the introduction. We're gonna only spend 10 minutes every month kind of talking about the social determinant. And then we're gonna really spend the rest of our time, the rest of our hour, 50 minutes talking to people who have impacted this, who have successfully brought this to the fore. So we'll be talking about the domain, but we're going to really talk to community groups and organizations that have impacted that area. You'll have a chance to talk. I love the conversation today. Want lots more for that. And then we'll be sending out other materials to help you as you begin to think about those things you want to work on and how you can work on them in your community. Next slide, please. Thanks for attending. The next session, please come. Krista Postai and Craig Carell are amazing. Anybody who knows Krista, she is a force of nature. Craig Carell is a force of nature. The Coffeyville School District had done some amazing things. He's a former superintendent of the year, I think in 2023, but I may have that year wrong. Krista Postai, took Community Health Center from this small organization in 2001. They now have over 60,000 patients, and that's probably low. But they also are really committed to schools and committed to communities, and we can understand why a school-based health clinic might be something that would benefit your community, but also how you can go about doing it and how you can partner to do that. The slides and materials are going to be sent out. We'll also put them on the website. Please email us with any questions or concerns or anything else you have.